Welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today in the show, we have Peter Valenzuela. He is a family physician and he's the author of the book, Doc Physician's Guide to Fixing Our Ailing Healthcare System. There's an excerpt from that book in Kevin MD titled Patient Surveys, The Quest for Positive Reviews. Peter, welcome to the show.
Hey, thanks so much for having me on the show, Kevin. I'd love to hear your podcast. I appreciate you making time for me.
Well, thank you so much for joining me, and we'll talk about your excerpt and book in a little bit. But first off, can you share your story and journey to where you are today?
Yeah, sure. I'm originally from Texas. Actually, I'm a family physician by training. I practiced rural medicine in Texas for about 5 years. During that time, I kind of realized I didn't know the business side of healthcare, so I went back to school and got an MBA while I was practicing, and kind of gave me different perspectives on how we practice and what we can do better. After 5 years of rural medicine, I went into academics, and I was the chair of a family medicine residency program in Texas. And then from that point on, I started going into large medical groups and integrated delivery systems. Journey took me to Bellingham, Washington, where I was a VP of the network out there for Peace Health. And then recently, I was at Sutter Health in Sonoma County, California, and now I'm with Mercy Medical Group as the Chief Medical Officer. Our group here in California, I'm in Sacramento now, is about 500 physicians, multi-specialty providers, and just celebrated my 1-year anniversary with the medical group here this week.
So one of the things that you mentioned struck me was that you didn't really know the business side of medicine until you started getting your MBA, and I'm sure that sentiment is fairly common among physicians. So what about the business side of medicine did you learn that you didn't know while you were practicing medicine?
Yeah, that's a great question. I was literally one of those small town docs that did a little bit of everything. And I was an independent physician that worked in shared clinic practice with a few other docs. So my wife actually did my billing. It was literally a mom and pop shop. Mm-hmm. And, the first time I decided to go back to school, I was waiting for my patients to be roomed. And I had one patient that said, Dr. Valenzuela, I've been waiting 45 minutes to see you. And I had been in my office waiting for the patient to be roomed. And so in my mind, I thought there's some problem with our throughput that I'm not understanding. So the first thought towards getting some type of business degree really was around process improvement and not letting my patients wait. But the second parts were around, how do we code? What gets denied? What do you have to pre-authorize? What's the process for referrals? And, a lot of the things that when you're in clinical practice, when you're in residency training, you're just trying to take care of the patient, but you don't realize what goes around taking care of the patient and getting credited for it and being paid for it and being successful.
Now, does it require an MBA for physicians to learn this business side of medicine?
No, I don't think so. I think there's, I've met a lot of people along the way that actually they started developing passions for different things. I have doctors that are certified coders, and I have doctors that work with insurance plans now because they were kind of on the one end when they were trying to do with pre-auth. So I don't think that it requires it, but you definitely need to have some type of practice management education or insights. And I'm glad that residency programs are now starting to try to incorporate that. I think the challenge with that at times is that the people teaching it may not have ever been in private practice. So they kind of teach you the academic aspects of practice management, but maybe not the real life scenarios of practice management.
So one of the things that we talk about is having physicians take more of a leadership position, because one of the reasons why so many doctors are burned out is because they don't feel like they're in control of the profession. Now, you've done it. You're a physician who's in a leadership position. Now, what kind of advice do you have for those doctors who want to go climb up the ladder and attain more leadership positions within the organization?
Yeah, I think for sure the first steps you should do if you're in an organization that's large or semi-large is get involved. Join committees, understand how the back end of a medical group works, or an integrated delivery system, whichever. Start being involved in different committees. I think the more valuable ones, if you want to go up in leadership, revolve around quality, value-based organizations, finance, compensation. Those tend to be kind of the key ones that people should have some grasp of as they move up the ladder. Not to say that the other committees are not as important, but I think that if you have some committees that you join that have business aspects, it really provides a little bit more insight. The other thing, is that's becoming more popular is really shadowing. I think that it's been great to see administrators come and round with the docs to see what it feels like. The docs can do the same thing in their own way, which is shadow the administration around what are some of the things that they're working on, and what are some of the issues being addressed. So I think those are a couple of things that you could try to do. Obviously an MBA or higher level education would be great, but not a lot of people have time for it. So it is a commitment. And if you're serious about that, there are executive programs where you can continue to practice, but do this on weekends or at nighttime or online.
All right, let's talk about your book now, as well as the excerpt. Your book is titled Doc Related, A Physician's Guide to Fixing Our Ailing Healthcare System. The excerpt is Patient Surveys, the Quest for Positive Reviews. So for those who didn't get a chance to read your excerpt, can you just walk my audience through it and share the story of why you decided to share that particular one?
Yeah, sure. I think that a lot of physicians and clinicians today are really struggling with trying to do what's best for the patient, and while also trying to make the patient happy. And I think that in my excerpt on that chapter from my book, I talk about the distinction between patient experience and patient satisfaction. Patient experience is doing the things that are expected during an encounter with a patient. Patient satisfaction is feeling like the patient got what they needed and they left there happy. Patient experience, they try to make more objective, like, did the physician see you within 15 minutes of your appointment? Did the physician review your medications? Patient satisfaction tends to be like, did you enjoy your interaction with your physician? And I think that somehow along the line, that's really become clouded together, where, patient satisfaction has really taken over, and understandably because of consumer-driven healthcare. But there's a lot of research that shows that making the patient happy all the time doesn't necessarily improve their clinical outcomes. In fact, it can do just the opposite. If a physician is hesitant to not prescribe something or not order a test because they don't want to upset the patient, it may result in higher cost or damage to the patient later.
Now, you're involved with a lot of administrators. Do they see that difference between patient experience and patient satisfaction?
Surprisingly, no. And that's the shame of it, is I think that for them, it's really, what can we do to make sure that we have patients return, to have return customers? And the dialogue hasn't really been aligned where physicians can say, I want the patient to come back, but I want to take care of the patient the right way, versus, well, we really want the patients to be happy, so we're going to add more coffee machines in the waiting room, and we're going to make the aesthetics look greater, and we're going to have the valet parking, and those are all nice to haves, but we also have to make sure that we take care of the patient well as also.
So I hear a lot about physician compensation being influenced by their patient satisfaction scores. Can you give examples of that type of influence? You certainly don't have to talk about your own healthcare system, but in general, how are patient satisfaction scores? How do they influence physician compensation?
Yeah, no, that's a great question. And I think that, healthcare is trying to drive more towards value and making sure that we're doing the right thing. And one of the things that they are looking at is the patient and making sure the patient's happy. A lot of organizations will base, 5, 10, even more percentage of the patient's total salary, of the physician's total salary, on their patient satisfaction scores. And I think that's a mistake, not because we don't want patients to be happy, but because a lot goes into making a patient experience well. The phones being answered on time, being able to be scheduled appropriately, making sure that, you've got a referral process, and being able to respond to the lab results, and understanding other aspects that don't directly involve the physician or clinician themselves. And when you make an incentive that's so individual centric, you lose sight of the team mentality of what it takes to care for a patient. And I think that's something that we have to consider.
So you mentioned attention there. Good care doesn't always lead to satisfied patients. There's an incentive for physicians to give patients what they want, precisely of the influence you mentioned about their satisfaction scores influencing compensation. What kind of advice do you have for physicians to navigate this tension?
Yeah, I think that's a tough one. And you led to it earlier. Physicians have to be involved in how decisions are made at the big table, at the leadership table. And I think when you have the right leaders in place, they understand this. When you look at healthcare organizations and you look at quality and performance, the highest rated healthcare organizations are physician-led. And it's not to slam non-physicians or non-clinicians, but I think there's an understanding of those people as to what we're trying to achieve, and I think that, just as an aside, what makes it even more difficult is that, now we're doing patient satisfaction online, like Yelp and others, and it's tough to deal with those too, because organizations aren't allowed to respond in a meaningful way to those reviews, because HIPAA doesn't allow us to say, this is really the deal that happened in this case, right? And so helping doctors understand that it's not fruitful for you to try to explain yourself online, because it's actually could harm you for doing it, is something that we have to educate people with.
So you mentioned in your article that one way to address this is how to fix how we use surveys. So can you talk more about some of the ways and solutions we can address this problem?
Sure. Yeah, no, I think that surveys should be used to see how we can be better at what we do. And when I say that, I mean kind of what I alluded to earlier. Are we able to get the patient in a timely fashion? Are we following up with the important things that the patient needs from a referral standpoint? Is the patient receiving information that's vital to being successful? And those are process improvements. And I think that having one survey to an individual is helpful to an extent, but conducting a broader survey where you ask about the caregivers that are taking care of the patient, where you ask the staff about what are some of the hiccups that are going on behind the scenes, where you look at other ways to enhance the experience, I think that's more meaningful. And we should not make this an individual score for a physician. We should make it a team effort for those people involved. And I think that's really vital to what we're trying to achieve.
We're talking to Peter Valenzuela. He is a family physician, and he's the author of the book, Doc Related, A Physician's Guide to Fixing Our Ailing Healthcare System. There's an excerpt on that book on Kevin MD titled Patient Surveys, The Quest for Positive Reviews. Peter, let's talk about your book, Doc Related. What are some key points that you want readers to come away with?
Sure. Well, I think first, the book is interesting because it's a medley of anecdotes and stories and data, as well as comics. For people that don't know, I've been making comics for about 5 years. And the comics they're satirical comics about the challenges of practicing medicine today, as seen through the eyes of physicians and clinicians. And so with each chapter, I cover topics like patient satisfaction, coding, pre-authorization, the EMR system, leadership and communication. And I start each chapter with an experience that I've had or someone that I know. Then I provide some data around that topic. And then I end the chapter with solutions on how we can make it better. And just as a plus, there's comics at the end of each chapter that talk about the topic. So it's supposed to be both educational, but as well as it should be entertaining and hopefully bring a few laughs along the way.
So give us a little appetizer. So what's a sample topic that you have in your book through the eyes of a physician, and what are some of your proposed solutions to that problem?
Sure. I have a chapter dedicated to quality metrics. I think metrics are important, but we don't necessarily measure the right things. When you think about the number of metrics in healthcare today, I think CMS has about 1,700 metrics. And, a lot of them are you checking the boxes, right? And there's not a lot of evidence to show that every single one of them improves outcomes, right? They're process metrics, and understandable because they are measurable. It's tough to measure the more important things. Remember, as physicians and clinicians, about 10 to 20% of the patient's overall healthcare is affected by what we do. The other 80 to 90% is based on their decisions, whether they're smokers or alcohol or live in underserved communities or have jobs or proper housing. And I think that what we need to reassess is, how do we truly improve our patients' overall health and outcomes? And if we cut back on the amount of quality metrics that we spent, we would save so much money that we could actually use it to help the things that matter to patients, like proper schooling, like vaccinations, like good water supply, like job training, like good housing. I mean, these social determinants of health weigh more on a patient than what we as physicians can provide. And that's kind of what the chapter alludes to. Also talk about how metrics can be gamed and how, there are misaligned incentives with that because we get paid for how we do things. And, I have examples of how we can meet a quality metric, but not necessarily do what's right for the patient.
So to that point, is it a binary choice? Is the money that goes to metrics preventing us from addressing social determinants or health? Is it an either or proposition, or can't we have both?
I think we can have both. It's always a yes and the key is that some people and some healthcare organizations are doing it better than others. And my hope is that we can learn from those organizations and spread the word so that we can focus on the right things. The challenge that we have right now, which you alluded to, is that healthcare organizations get so big, it becomes a very financially driven decision. And so sometimes doing the right thing doesn't pay you, right? I can get into behavioral health, right? We know behavioral health is a big factor in the US system, but the reimbursements are low and they're hard to find. And so a lot of organizations just don't deal with behavioral health, they contract it out. If we really could focus on doing the right thing, it would offset costs down the road. And that's something we should think about.
And my final question, what are some of your take-home messages that you want to leave with the Kevin MD audience?
Yeah, number one, I would say, first, I'll make a pitch for you. You should watch Kevin MD and read Kevin MD pages because they're really informative. Second, I would say that, it's like the old adage, if you're not at the table, you're probably on the menu. And I think we as physicians and clinicians need to find ways to get to those tables where decisions are being made, because we can definitely influence and impact how we provide healthcare. We just have to have the right people that are motivated to do it. And you don't have to be a physician. If you're a healthcare person in any way and has clinical skills, that's something to think about.
Peter, thank you so much for sharing your time and insight. And thanks again for being on the show.
Hey, thanks so much for having me, Kevin. Appreciate it.